Practitioners are being called on more and more to provide moderate sedation to patients for office surgery, same-day surgeries, and hospitals large and small. While proper moderate sedation can be safe for the patient, if the proper rules and guidelines are not followed, it can be a nightmare. Keeping up with continuing education credits can make your sedation practice safe from costly or even deadly mistakes. Don't put your license in jeopardy. Get certified now. 5 ways to receive Sedation Certification: our campus, DVD at-home study, your facility, multi-user license, online course.
We're going to talk about recommended practices and policies. In some areas, the things we're going to talk about are not recommended. They are state mandated, or at least by the licensed Board of Nursing in your area. They have position statements on some of the things that we are going to talk about today. We're going to talk about what are the indications to go through those types of sedation. One of them, we want to minimize anxiety and discomfort, thereby avoiding undesirable autonomic reflexes. And what are autonomic reflexes? Autonomic means automatic, which is fight or flight reflexes. So what can some of the consequences be? I'm going to go over this slide fairly quickly. We'll talk about them more in depth later. But on slide 12 it says respiratory depression. That's a yank, but you're going to be given medications that cause respiratory depression. Airway obstruction. They get too relaxed, laying on the back, that tongue can fall back, and all of a sudden you hear this change in the pulse ox. So the things that we'll talk about when we get into JCO on slide 27 is definition, training required for LIPs, non-LIP participants, residents, and fellows, patient evaluation, medications, monitoring, resuscitation equipment, post-procedure transport, monitoring and recovery, discharge, and quality assurance. All of these are part of the things that you, the nurse, are involved in. So let's look at preoperative sedation assessment. You need to pay attention to the things that you as a nurse, which you may not have thought about, are responsible for. Agents used for conscious sedation: primary medications, benzodiazepines, opioids, anesthetics, alpha-2 receptor agonists, reversal agents, and emergency medications. So these are some of the things we're going to be looking at. So what about age-specific considerations? For geriatrics, there's not a whole lot to be concerned about, but there is a couple of major ones. Beginning of late adulthood geriatrics is 65 years. The functional age is much more important than his or her chronological age. So I don't care if they're 70, if they act and look and can do the things of a 60-year-old, then that's how you treat them. Okay, we're going to talk about pediatric sedation. They're not just little adults, they're different. So let's look at, we want to keep these kids happy. We don't want them screaming. I don't want it the way it was my very first job, which is me working in the emergency room, and all we had in those days was what? A papoose board. You tied them down so they couldn't move. So we're wondering why that generation's a little crazy.
So should RNs push propofol? Patient safety risk is only 74%. It's considered outside of the RN's scope of practice. It is not part of training to learn and be proficient in airway management. That's usually something you learn outside of your training later.
Sometimes the anesthesia comes down with it. They'll come, like in a trauma situation, it'll be drawn up and in their pocket, and they'll give it to someone, they'll hand it to the nurse to push, and it's like, why? We can't do this. I had one in a trauma case where he said, well, I'm going to hold this guy's C-spine. It's in my pocket. Just go ahead and do that. Yeah. That's why you're here,
Because you know how to hold C-spine, right?
I can do that.
Come on.
Aren't you here to intubate, or they're the first ones to push everyone else out of the way.
Right.
You push it, you brought it, you push it. I don't know what that is.
That's right. So you're within the scope of practice to say, I will hold C-spine for you while you give this drug.